My name is Leslie Phelps, and today we're going to go over patient rounding. So ladies, we're going to go over the importance of patient rounding, and we're going to go through a few scenarios, and then we're going to discuss those scenarios. We're also going to utilize a couple of visual items that we can also use to help us with patient rounding. So first, I just want to reiterate that there is a lot of literature out there in regards to patient rounding and evidence-based practice showing how it does improve patient care, improves nurse time management, and improves the overall quality of the patient's perception of their care. So patient rounding is a very proactive process. So you're planning ahead. So you're planning on seeing your patient every hour of the day, every 2 hours at night, and making sure that all their needs are addressed in the hopes that, for one, it will cut down on their need to push the call light and wait for you to come in because they have already either had their needs met or they know that you will be in soon to assist them or help them with whatever needs that they want. It's also a visual item that families can also see that their mom or dad or brother, sister, wife, that they're being taken care of on an hourly basis, and that also cuts down on their worry about their family members being taken care of. So that it's a very proactive process, and it's also a very patient-centered process in which it's aligned with our facility's missions and values to, to give the best possible quality care that we can give within our facility. So it's very aligned with our mission statement and the values that we portray here in our healthcare system. It follows a delivery care model that really focuses on your time management, so again, the hourly rounding, and also towards patient satisfaction, where you will utilize and optimize on the patient's perception of using keywords, scripting, visual items, talking about goals, talking about the plan of care, all those things the patient absorbs into their care, and so they also become interactive with their plan of care. And it also has some accountability too, because you yourself know, oh, I've got to get in there and round on my patients, and it's everybody's responsibility to partake in that rounding too. Techs, nurses, everyone involved in the unit. So the rounding process, we're going to utilize not only our verbal scripting and keywords, we're also going to utilize the whiteboard, which we can put in our goals for the day, our goals for discharge, any tests and procedures that are going to happen today, so that kind of your whole plan of care is laid out for you when you come on. So when you come in, you're going to want to put your name up here. You're going to want to, so that they know who's taking care of them today, maybe who their tech is today, if they're going to be doing any tests, procedures, if lab's going to be coming in today, if you happen to know who that person is or who's going to be on for the day or the time, any details that you can give the patient so that they can be in tune to how their day is going to go and how their care is going to flow. Again, we have the rounding log. This shows every hour, and of course at night you don't want to wake the patient up every hour if they're sleeping if it's not necessary, so we go to every 2 hours at night, but you will document on the rounding log that you've addressed pain, potty, positioning, personal belongings, and then any other personal things or clinical things that you need to address at that time. You don't have to remember it either. Also know that this is a cheat sheet for you. So if you've come in and found something on the floor, you're going to do your visual assessment, and then you come over to sign and you realize, oh, I forgot to ask her about her position. Then you can always go back and assist the patient with positioning. So always know that, you don't have to be perfect every time. It's not like it's a movie scene and you have to know your script. You can always come back and use this as a reminder of anything that you might have forgotten or that you need to do before you sign off on it. Okay, so let's go over a couple scenarios. So, Mrs. Smith, Nurse Smith, I'm going to have you come in and just do the one scenario, the visual assessment. It's the beginning of your shift and completing the whiteboard, just kind of the beginning of the rounding process. Okay? Okay.
Jones, how are you?
I'm doing pretty good, thank
Hi.
you.
Good. I'm Miss Smith. I'll be your nurse today, okay? All right. I'm just going to put the side rail up for your safety.
Okay.
So you won't come down. And I'll put my name in here, okay?
Okay.
And I'm Miss Smith. I'll be your nurse for today. So you can finish lesson, call me if you need anything, okay?
Okay.
In the day.
Okay, that's a great start to rounding. So now, why don't you go ahead and come in and continue on with another part of rounding where you're assessing the 4 Ps. Okay.
Good morning, Ms. John.
Good morning.
I'm Smith, and I'm going to check on you, and I'm going to be another nurse taking care of you.
Okay.
And are you feeling okay right now?
Actually, I have a little bit of pain in my
Good
back.
pain?
Yeah.
Like a 1 to 10, what would you say your pain level right now?
It's probably about a 3.
About a 3?
Yeah.
And what would be your goal for the day? So I will write down on the board, and we'll try to manage your pain. And you regularly give some pain medicine like ibuprofen, and in between if you need anything, you can
Okay.
always ask for that, okay?
Okay.
And I will write down your goal for pain.
Probably a 2. I can handle a 2.
Right now it's about 2.
Oh, now it's a 3. But
About 3 right now.
I'd like it to be like a 2 or
Okay.
less.
Pain goal is less than 3. And the next pain medicine you could have about 10 o'clock this morning.
Okay.
And then let me see your position. So I can get you some pillows and get you, you've been on your back all this time?
I have.
can
I
get
just,
you
I'd like to
turned
turn
little
over a
bit.
little bit.
Yeah, let me see if I can turn you a little bit on your side, just a little tap. And then see if that makes your back feel a little bit better. And then here's a call bell. You can call us
Okay.
anytime, and I'll go and get your pain medicine now. And let me make sure all your belonging, your water pitcher, and your watch and everything close to you. And we have this hourly rounding, and so I will be coming and checking on it. And can I assist you to go to the bathroom? Do you need to go?
No,
to the
I don't need to
bathroom?
go right now.
Okay. You just let me know if you do, okay? I'll be back with your pain medicine.
Okay,
And
that
I
is
have lots of
excellent.
time, and if you need anything else.
Okay, thank you so much.
Okay, that's great. And then, of course, you would sign the log when you're through, and make sure that you name and initial and date, and then, of course, the patient sticker would go up here. So, if you'll come around here, let's go ahead now and let's just talk about the 2 scenarios that we just did. So, when you came in and you told the patient, oh, I'm going to raise your side rail for your safety. Safety being a key word in scripting and rounding, how do you feel that that differs from someone who just comes in and just pulls the side rail up and checks around?
Just pull it up, patient doesn't know why we are doing it. But if I mention that word safety, they're thinking, okay, that nurse is being cautious about my safety when I'm in the hospital. So
Right.
she feels safe, the patient feels safe.
And did that feel any different to you than, let's say, if I just came in and kind of pulled the side rail and I said, hey, good morning?
Yeah.
Yeah, okay, great. Okay, now let's talk about addressing the 4 Ps. So how do you think that is, having that 4P kind of in the back of your mind, making sure that you address those every hour, how do you feel that that kind of differs from before we started the hourly rounding, where we didn't really always keep those in mind?
That's great. So, and also we have a cheat sheets and see if did I address 3 things or did I forget like one more thing? So it does help to recognize that, let me see, one more thing, so I need to go and ask.
Yes.
And that was helpful.
I think the level of call light or calling out for the patient can be reduced because every hour somebody is here and if they are in pain, they of course can say that out instead of sitting in pain. When we explain to them this is your goal and next event is your pain medicine, they can keep that in their mind and they can call before the pain gets worse.
And did you, as the patient, feel like all your needs were met and then maybe felt more at ease because you knew she's going to come back in an
Right,
hour. You
yeah.
also know that she's very aware of when you can have your next pain med, so you're not kind of wondering, does anybody know when I can have another pain med?
It's a very comforting thought.
Good, good. Okay. Well, I think that this process being instilled on our unit is going to make a huge difference in the patient care and mostly in the way the patient perceives their care. And I think that we're going to hit the mission and goal of our facility of giving the best quality of care when we implement it at 100%. So